Good afternoon and welcome. We are so excited about today's webinar. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith and Opportunity Initiative, CFOI, and the Veterans Health Administration, Office of Rural Health. My name is Trulesta Pauling. I am the Senior Outreach Specialist in CFOI. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question, please type it in the Q&A box on the right side of your screen. At the end of the presentation, I will read the questions for the presenter to respond. This is a live recording. I would like to thank VHA and Dr. Thomas Klobucar and his office for this collaboration. We are grateful for your presentation today on caring for rural veterans. Now I would like to introduce to you Mr. Conrad Washington, the Acting Director of the VA Center for Faith and Opportunity Initiative.
Thank you, True. I appreciate it. So I want to first also piggyback off of Trulesta and thank our special guest, Dr. Klobucar, for taking time this afternoon to share with us on caring for rural veterans. I also want to thank all of you for taking time this Tuesday afternoon to join us. So we here at the VA Center for Faith and Opportunity Initiative, we host webinars just like the one we have today, 2 to 3 times a month on a wide array of veteran-centric topics. Faith, which is things hoped for and evidence not seen, can also be translated to hope and optimism. Many veterans and their families may lean on their faith, especially now in this difficult time in our country as we're all facing the pandemic. So we here at the Center of Faith, we seek partnerships and collaborations with faith-based organizations across the nation to help us reach the 20 million veterans. Our focus is ecumenical, so we welcome all faiths and all denominations to join us if they have veterans in their congregations. So sit back with your coffee, your tea, and a pen, of course, and enjoy this presentation. Ms. True, it's all yours.
Now I would like to introduce Dr. Thomas Klobucar, the Director of the VHA Office of Rural Health. Dr. Thomas Klobucar was named Executive Director in 2018. He leads the Office of Rural Health, managing a broad portfolio of partnerships with clinical program offices, research initiatives, and a strong innovative program that has produced no fewer than 20 rural promising practices and 50 enterprise-wide initiatives that have been disseminated across VHA to increase access to care for hundreds of thousands of rural veterans. Exercising oversight of the Rural Health Initiative's annual budget of $300 million, Dr. Klobucar also oversees the activities of 5 veterans rural health resource centers in Iowa City, Iowa, Salt Lake City, Utah, White River Junction, Vermont, Gainesville, Florida, and Portland, Oregon that serve as hubs of rural health research, innovation, and dissemination. Before he came to VA, Tom worked at Commercial Research and Academy and has held faculty appointments at the University of Iowa College of Public Health and the Iowa State University Department of Political Science. Dr. Klobucar spent his military career as a cryptologic Russian linguist, that's a tongue twister, and then as an armed control inspector / interpreter working on execution of the Intermediate Nuclear Forces Treaty of 1987 and the Treaty on Conventional Armed Forces in Europe of 1990. Dr. Klobucar is published in the fields of rural health, home telehealth, political science, Soviet studies, sociology, and research methods. Now I give you Dr. Thomas F. Klobucar.
Hi, thanks for that nice introduction. I appreciate it. This is Tom Klobucar, and I just want to say, we're going to talk today about VA's rural health programs and services. And when we step into this topic, We're going to give you a little overview, maybe talk a little bit about the VA Office of Rural Health and our Veterans Rural Health Resource Centers, and then our programs. But as we go through here, what I'd really like is that if you think of this as an opportunity to consider collaborating with the Office of Rural Health, we're going to talk about all these programs and some of those ones that Trulesta mentioned in the introduction. But the fact is none of those would be possible without the partnerships that we have inside VA with clinical program offices and other program offices like the Center for Faith and Opportunity Initiative, but also with non-governmental organizations like veteran service organizations and other community organizations that are interested in addressing access issues for rural veterans, and other federal agencies as well. We have active partnerships with FEMA, with U.S. Department of Agriculture, with the Federal Communication Systems and other federal agencies, all focused on one thing, and that is increasing access to care and services for our rural veterans. So as we go through, please put your comments in the Q&A box, and we'll be more than happy to talk about those, and feel free to contact me or anyone on the rural health staff if you've got an idea about how we can collaborate on any issues at all that affect the care and services delivered to rural veterans, or if you want to just start a dialogue or have questions about today. You'll hear me say this several times throughout today's talk. www.ruralhealth.va.gov is our web address. We've got a lot of great information on there about some of the partnerships that we already have, and some of the research that our folks have done in the area of issues affecting rural veterans. I think you'll find a lot of useful tools on that website and a lot of great information about rural veterans and opportunities that you might be able to think of to increase their access to care. So I always like to start off talking about rural veterans and VHA's relationship with rural veterans by talking about some of the challenges that we face. I'll talk a little bit later about the creation of the Office of Rural Health, but the Office of Rural Health was created in the face of these challenges back in 2006, and a lot of these continue through to today, and some have even been exacerbated for a variety of reasons that we'll talk about it. If you look at this circle, and I really like this graphic because it kind of represents the barriers that the veterans face in achieving and getting access to care, provider shortages in rural areas, and we'll address those in some detail here very shortly. But the geographic and distance barriers that all of us know that rural dwelling people in general in the United States face, but can be particularly acute to our older veteran population. The social determinants of health aspect. We're going to see a slide here next. The next slide I'm going to show you is going to demonstrate that our veterans tend to be older, they tend to be sicker, they tend to have less money than their urban veteran counterparts, and they face those particular challenges in housing and transportation and education that their urban veteran counterparts don't face nearly as, they aren't nearly as acute in urban areas. And then finally, and this is most importantly, it's really interesting, there's a lot of emphasis on this now, limited broadband coverage. One of the things that the COVID-19 pandemic has showed us is that technology is a significant player in easing access to care for veterans across the board. But when you live in a rural area, as many of you probably know if you've ever lived in rural areas, and I spent 18 years in the great state of Iowa and did ag research for a while, and I know that you can go places in those rural parts of this country and you can't get a broadband signal to save your life. These broadband coverage challenges have been around for a number of years. There's a lot of action being taken right now at the executive level in the United States to try to address some of those things, but those broadband challenges continue. And so how do we overcome some of those things? And we'll talk through a little bit of that here in a minute. So this next slide, which is one of my favorites of all time, this snapshot of rural veterans, it really shows kind of the differences between rural and urban veterans. You know, the tab in the middle shows the story of all veterans in the United States. You know, there's right at about 20 million veterans in the United States. Of those, 8.5 to 9 million are enrolled in VA. Now, not all those come to the VA's doors for care every year, but the fact of the matter is a significant number of those, around 6 million plus, come to the VA for care every year. But, you know, 8.5 million to 9 million are we consider enrolled in VA for care, and therefore could walk through the front door at any time. And that represents about 42% of all the veterans. So you think about that 20 million veterans, that 8.5 million veterans, that represents about 47% of the 20 million. If you look at, you know, if we split those up, so what we did, we took those numbers, we split them up, and we looked at rural and urban veterans. And if you look over at the left-hand side of the screen, you know, the rural veterans comprise about 5 million, which is 24% of all the veterans in the country. And 2.7 million of those are enrolled in a VA for care. That's 57% of all the rural veterans there are. If you look over at the urban counterparts, it's 37%. It is clear that rural veterans depend upon the VA for care at significantly higher rates than urban veterans. This is a really important fact. You know, and we tend to think about veterans in an urban setting because, well, the bulk of them live there. But when you look at the reliance on VA for care, this demonstrates very clearly that we are a very important part of the rural veterans' access to care. And if you follow down the demographics here, we look at 7% of women. Women tend to be, are more likely to be in urban places, and the numbers are smaller in rural, but that makes it even a greater challenge for us to ensure that our women veterans have the access to the care and services that they need, because some of those specialized services are even less available in rural areas than services that apply to everyone. We tend to have less money. About 55% earn less than $35,000 a year, as opposed to 49% in the urban area. And of course, our population is disproportionately older than 65. So this kind of paints a picture of what demographically our rural veterans look like. If we go to the next slide here, I got a little. This shows what rural looks like in the United States. So the Department of Veterans Affairs and the Veterans Health Administration, we use a system for classifying rural areas called the Rural Urban Commuting Area System. It's a little complicated, but what it does is it considers access to services and geographic distances to services as to help determine what rural and urban are. The Census Bureau uses a somewhat simpler system but if you look at the Census Bureau system and the Rural Urban Commuting Area System, one thing is clear across the board. The bulk of America is rural. And if you look at this map, the dark brown areas are what we consider highly rural. And I think the easiest way to think about highly rural is basically 7 people or fewer per square mile. 7 people or fewer per square mile, that's highly rural. And if you look at these dark brown areas, that's a significant portion of the land mass, especially in the western United States. But look up in the northeast as well, you can see there's a significant amount of highly rural spaces in the United States. The rest of it, the khaki color in the background, is rural. And rural is, they're closer to services, but they don't have the density of services that they have in urban areas. Urban areas, and again, an easy way to think of that is basically anywhere that has a population of about, any population center that has a population of greater than 30,000 people. So that's kind of the juxtaposition. There was an article in the Washington Post about 4 or 5 years ago that discussed the different definitions of rural that the federal government has And I think they settled on, there were 15 or 16 definitions that different agencies used to determine what rural meant. All that is true, but the important thing to remember is the bulk of the land mass in the United States is rural. And when we talk about the issues that rural people face that urban people don't here in a second, I think that's the important thing to keep in mind, not splitting hairs on what definition we should use for rural or urban. So this next picture, this is a heat map, I guess they call them. But each little dot represents a rural veteran. So if you look at the density of rural veterans in the United States, surprisingly, you can see that the eastern half of the United States, east of the Mississippi, has a significantly higher concentration of rural veterans or veterans living in rural communities. And as you move further west, you see it's less dense, which presents its own special challenges because that means that those veterans that are there are significantly further away from care than the veterans in the East. So this is a great map. And so we're going to look at some other maps here next. And what I want you to do is keep in mind what that rural map looks like and keep in mind what this map looks like. So if you keep those two in your head, and we'll go down to the next map here. And this shows health professions shortage areas. You know, our colleagues at the Health Resources and Services Administration, which is part of the Department of Health and Human Services, they actually conduct a census of all of the healthcare providers, primary care and mental health care providers across the United States. And they publish maps on their website. And I highly recommend that you go there if you want to get a real good feel for what these professional shortage areas look like. But do you remember the map that we showed you of rural in the United States? Well, this is a map of rural when it comes to primary care services. We'll talk about some details about these shortages in a minute. The next map shows you the health profession shortage areas when it comes to mental health. And then once again, you can see these are more acute everywhere, but the shortages are concentrated in rural areas. These health profession shortage areas maps are basically maps of rural America. And those shortages are faced by the community and they are faced by the Department of Veterans Affairs both. And when you have rural communities that have no mental health providers, that affects veterans, that affects their families, their neighbors, and their friends. And a few figures on this. So 80% now of rural America is classified as medically underserved. And while rural is home to about 20% of the U.S. population, it has fewer than 10% of its doctors. And that's worsening each year because of the gray wave. And this is not the same thing as a silver tsunami, which is all those baby boomers getting older. The gray wave, we're talking about doctors. Rural doctors tend to be 3 years older than urban doctors. Half are over 50 and a quarter are beyond 60 years of age. We project that rural doctors will decline by 23% over the next decade. So that's going to take an acute situation and make it even worse. In the area of mental health, and these next few figures here, these next bullets here, these are really sobering. When you look at entirely rural counties in the United States, there's about 3,000 some odd counties in general. Of the 734 counties that are entirely rural, 3% have 1 to 4 psychologists, 4% have 5 or more, and 93% have no licensed psychologist. 93% have no licensed psychologists. And hundreds of thousands of men and women live in those places. Thousands and thousands of veterans live in those places that have no licensed psychologists. And when we turn to geriatrics, we said before that our rural veterans tend to be older than the rural non-veteran, and they tend to be older than urban veterans. 60% roughly are over the age of 65. And the American Geriatric Society, they oversee that area. They have found that those over the age of 65 use a disproportionate percentage of healthcare services, and I think We all know that. But more than 80% require care for chronic conditions such as hypertension, arthritis, heart disease, and primary care physician shortages continue. The impact is enormous. That's just a real short picture of the challenges. There are more. We could go in depth about broadband distribution in the United States. We could talk more about the social determinants of health, and we could talk more about provider shortages until the cows come home. But the fact of the matter is, I think we've got a picture of an acute situation in rural. Well, you know, back in 2006, a group of veteran service organizations and congresspersons from states that have significant rural areas and that have congresspersons that have significant rural concerns, they passed a law that mandated that VA establish an Office of Rural Health in the Office of the Undersecretary. And the VA Office of Rural Health came into being. The bill was passed in December of 2006. We stood the office up, and I say we, I wasn't even in VA at the time. The office was stood up in 2007, and so it's been in existence now for about 13 years at the end of this year. And this is a picture. So the law they passed, amended 38 U.S.C. Section 7308, and it created a mandate for this Office of Rural Health in cooperation. And I love this part because it really underscores the spirit of collaboration that we try to capture in the Office of Rural Health, because our partners make all things possible for us. And so in cooperation with the medical rehabilitation, health services, and cooperative studies research programs in VHA, assist the Undersecretary to conduct, coordinate, and promote and disseminate research information into issues affecting veterans who reside in rural communities, and to develop, refine, and promulgate policies, best practices, lessons learned, and innovative and successful programs to increase access to care for rural veterans. This was kind of the original package of legislation that Congress passed, and the Office of Rural Health established, using this legislative mandate, established new programs, and one of those new programs we established were Veterans Rural Health Resource Centers. And Congress, a couple years later, after it saw what the Office of Rural Health did in establishing these Veterans Rural Health Resource Center, they kind of enshrined them in the same in legislation and amended 38 U.S.C. 7308 again, and presented the Office of Rural Health with this legislative mandate that these resource centers are there to improve the understanding of the challenges rural veterans face. Those data that I talked about before, about provider shortages, about what the challenges that are inherent in rural, a lot of that work was originally done by Veterans Rural Health Resource Centers in VHA with the help of their external partners in those areas of research. They're also supposed to identify disparities and then to formulate practices and programs to deliver health care to rural veterans. They engage in the classic research cycle, research and innovation cycle. They identify an issue, identify a disparity. They formulate practices and programs to deliver health care to rural veterans, and develop special practices and products for the benefit of rural veterans across the system. That's that research, innovate, and disseminate model that the 5 Veterans Rural Health Resource Centers use. That also extends to the innovative partnerships that we have inside VHA and with our external partners to improve access to care and services for our rural veterans. Based on that legislative mandate, the Office of Rural Health is also directed by Congress to have a strategic plan. And so our current strategic plan, which was formulated last year with the participation of a number of external partners, external to the federal government, professional associations and non-governmental organizations, and with federal with partners across the spectrum to develop this plan. And the vision is to ensure that America's veterans thrive in rural communities. And in order to achieve that, our mission is to improve health and well-being through research, innovation, and the dissemination of best practice for our rural veterans. These objectives listed below drive us to accomplish that mission, and we use these objectives to make determinations about what actions we should take. And this entire strategic plan feeds into the VHA strategic plan and the VA strategic plan, and all with that singular focus to ensure that Americans, veterans thrive in rural communities. And so we have objectives around each of these, around our mission. And when you look at our objectives below that, though, you can see they're all about collaborations, collaborating with non-governmental organizations that support rural veterans, expand our partnership and programming reach, use relationships within VA and the federal government to exchange rural-centered information. Those are all around that kind of as finding that information and identifying gaps in care for rural veterans. Reducing rural health care workforce disparities, just talked about that in great depth, but actually expanding our understanding and supporting the rural implications of the Mission Act that is given to us by Congress to help us enhance care for all veterans in several areas, particularly rural veterans. And then finally, enriching the rural veteran health, research, and innovation. Again, that's something we do with partners both inside and outside the VA. So let me stop for a second and talk a little bit about those resource centers. And I consider these Veterans Rural Health Resource Centers kind of the pointy end of the rural health sphere in VA. These 5 resource centers, and as Tulesta mentioned when she introduced this topic, are located across the country. Portland, Oregon, and Gainesville, Florida are our newest Veterans Rural Health Resource Centers. White River Junction, Vermont, Iowa City, Iowa, and Salt Lake City, Utah were our founding resource centers. They do a remarkable job. Each has their own special area of emphasis, and each has their own, each leadership team has their own area of specialization. And so we're going to talk a little bit about their programs in a minute, but then now I want to talk about enterprise-wide initiatives. So we have the resource centers off conducting research as our legislative mandate tells us to do. These enterprise-wide initiatives were developed by the Office of Rural Health in conjunction with its partners in clinical programs and transportation programs and innovation programs in a variety of different areas with the idea, you saw our legislative mandate that said we were supposed to disseminate things system-wide. Our enterprise-wide initiatives are the tool that we use to do that. We developed these after a number of years of experience, and in 2016 is when we started using the enterprise-wide initiative model, and you'll get to see how effective that model is here in a minute. But the enterprise-wide initiatives, the idea is that they rapidly address systemic access challenges in rural and expand national programs to rural. Our program offices partners provide oversight. They provide mentored implementation for these new sites where they stand up these new programs. And these new programs are in everything from primary and specialty care and mental health to transportation, research, clinical resource hubs, et cetera. Our 2020 portfolio has more than 50 of these access initiatives, and they have been adopted at 99% of VA medical centers across the country. I know what you're thinking. 99% of VA medical centers across the country, well, some of those are bound to be urban. That's absolutely true. Another interesting tidbit of information is that more than half, 56% of our rural veterans go to urban VA medical centers for care. In order to ensure that we reach those veterans as well with ORH and our partnership programs and our enterprise-wide initiatives. Some of those urban centers, VA medical centers, adopt rural health programs in order to serve those veterans. So these enterprise-wide initiatives, that's kind of where the rubber meets the road for us. The enterprise-wide initiatives and this kind of shows how they're disseminated. These national VA healthcare programs, our partners in all these different areas come to the Office of Rural Health and say, hey, I've got this great idea. Let's partner and do this. And so we work together to create a rubric under which they can kind of disseminate this practice. And then, with their leadership, we fund these programs at these VA medical centers across the board. And if you look, and it's kind of hard to see this map. I got a little screen here, so it's especially hard for me to see this map. But each one of those dots represents a enterprise-wide initiative in fiscal year 2020 for the Office of Rural Health. And you can see that we're pretty widely distributed. I think this map says a great deal about the perseverance and the kind of dogged determination that our partners have in getting these programs out to these VA medical centers. And here's just some highlights. And I got a complete list I'm going to show you in a minute. It's too long to read and too big to read. But these are some highlights that we wanted to talk about. And it's interesting because the introductory video that was played when this meeting started was around rural suicide prevention. We have an enterprise-wide initiative that really supports that the VA's larger rural suicide prevention effort. It connects veterans with suicide prevention services and resources through enhanced education, public awareness, and basically care management for high-risk individuals. And this next one, Rural Access Network for Growth Enhancement, we call that RANGE. It provides intensive case management services, including homeless outreach. And, rural homelessness is one of those issues that hides because it's difficult. You can't find concentrations of the rural homeless. The rural homeless are particularly hard to reach. This program addresses that issue, especially for seriously mentally ill veterans in rural areas. And we also have some web-based programs, and these are particularly important. We've got Vets Prevail. This is a web-based behavioral support program, and veterans can join in when they want, but it really helps veterans suffering from depression or post-traumatic stress disorder, and it gives them kind of the tools to overcome some of those challenges. And then a social work and patient-aligned care teams. And I want to emphasize that the Office of Rural Health is in the business of putting people together with programs and programs together with veterans. And so rural suicide prevention, this is a small part of the VA's much larger suicide prevention program. RANGE is just part of the much larger effort to address homelessness across the board in VA. And credit for these goes to our partners in mental health and in social work. And if you look at the next slide, you can see that's a list of what we've got in the field right now. And I won't go through this entire list. Trust me, you don't want to hear it. You can read it whenever you want. But all of these enterprise-wide initiatives are there and available for local VA medical centers. If they think that's a need in their area, they can come to the Office of Rural Health, and we'll help them, along with the clinical partners, to stand this up at their VA medical centers. So the Office of Rural Health, our total annual budget this year in FY 2020 is $300 million. And as I said, for that $300 million, we've initiated 50-plus enterprise-wide initiatives at 99% of the VA medical centers across the country. And if you look at over the years how many veterans we've served with our funded programs, you can see that we're getting there. We're getting there. We're trying to be more efficient with our dollars every year. And so in FY 2017, our budget was only $250 million. And then in FY 18, they increased us to $270 million. And this last year in 2020, Congress increased our budget to $300 million. We expect those numbers to continue to increase. And the fact that we can serve 3 million unique veterans through our partnerships, through our program partners, I think that's that's something we can do better at, but it's pretty doggone good, and we're going to keep working hard to make those numbers go ever higher and higher. And if you look at the number of VHA sites served, we are at 600 VHA sites. Now, those are unduplicated, and those include our programs at community-based outpatient clinics, at primary care telehealth outreach clinics, at VA medical centers, at healthcare centers, and virtually anywhere that VA has clinical programs, we can help them stand up these programs in conjunction with our partners. And this is our expenditures on enterprise-wide initiatives in millions across the board. If you look at the 265, you're going, well, you got 300 million, where'd the rest go? Well, the rest went to things like our Veterans Rural Health Resource Centers and our partnerships with research and innovations and so on and so forth. This is the money that went out to those enterprise-wide initiatives we listed before. I wanted to show a video here, and this is my fault. I didn't prepare properly to make sure that you guys could see this video. So what I'd like you to do is go to www.ruralhealth.va.gov and look up, and if you look on the left-hand side, just like every VA website, there's a menu over there, and then one of them says For Veterans, and you can go to the For Veterans tab, and you can see this and a number of other videos that talks about the programs that our partners have stood up with the assistance of the Office of Rural Health. This one on rural veteran transportations, and you'll see this picture when you see the link. Is truly extraordinary. What a very small amount of money, but a determined and innovative person at a VA medical center in rural Vermont can do to stand up a rural veteran transportation program that is truly remarkable, that actually partners with local transportation systems, that partners with regional transportation systems, and things like Uber and Lyft and all those other things. They come together in this terrific rural transportation program that we use now as the paradigm for how people should stand up transportation programs. And that's one of the things that we really strive for our partnerships to achieve, is to enable that local innovation, enable those people who have these terrific ideas on how to change things for the better for rural veterans and increasing access to care for them. And this is one very good example. So please, if you get time, www.ruralhealth.va.gov. So let's talk a little bit about promising practice. So we talked about the enterprise-wide initiatives, and that's where we spend the bulk of our budget. But the promising practices are spawned out of our Veterans Rural Health Resource Centers. And this is where we create really innovative new programs. And one of my friends and colleagues once told us that, you know, what we're trying to do at our Veterans Rural Health Resource Centers is we're not trying to create magical new programs. We're basically kind of trying to break apart what's out there and put it together, back together in new and different ways. And you'll see when you look at some of these programs how they've managed to do that very effectively. So our Veterans Rural Health Resource Centers come up with these programs, these innovations, and they test them, they pilot them, and they go through an expanded pilot process. And then at some point they say, okay, this is a mature pilot. We want this to be considered for rural promising practice status. And so we ask these 6 questions. Does it increase access to care? Does it evince strong relationships with partners inside and outside VA? Does it have clinical impact? What does the return on investment look like? What is the operational feasibility of actually standing this up? And what does customer satisfaction look like in this context? Do veterans like it? Do they feel like they're getting something that's worthwhile? If they pass all these criteria, then we turn them into a rural promising practice, and we distribute them across the country through mentored implementation with our Veterans Rural Health Resource Centers. So here's some of those rural promising practices for which we give mentored implementation support. Clinical video telehealth comprehensive care to veterans with MS. Veterans with MS getting therapy in their homes on iPads, and this was happening a decade ago and it matured so quickly and became so popular with veterans so quickly that it was one of our first promising practices back in 2014. Community clergy training to support veterans' mental health, and we'll talk about that in a minute in some more depth, but that was one of our founding in rural promising practices. Geriatric scholars training and GREC, those two are focused on provider education. Remote home-based delivery of cardiac rehab. This has been a boon to rural veterans. It's an award-winning program that's got national awards. It basically puts cardiac rehabilitation in rural veterans' homes. And you know how hard it is to find a cardiac rehab center out in rural America? We put it right in their homes with this, along with dietary and mental health counseling. And then telehealth collaborative care for rural veterans with HIV. If you want to know the details on all these, please be sure to check www.ruralhealth.va.gov, and you got a hot link on there. And I'm hoping that our partners in the center will make this slide presentation available to you after this is over. But if you go to our website, you can find it. And this map just shows where our rural promising practices are across the country. You can look at that at your leisure. I think it's important to note that these have been widely distributed by our resource centers. I consider them our small but mighty resource centers. They do yeoman's work in putting all these programs together and disseminating them across the country. And they're having a real impact on veteran care. We've seen some of these data before. This is a different way to look at it. I won't dwell on that. I do want to spend a couple of minutes before we go for questions to talk about our community clergy training to support veterans' mental health program. Dr. Juliana Lesher in Veterans Health Administration is our partner on this program. It was really initiated back in 2010. Again, this is before my day in VA. But the idea is to disseminate a program that helps rural clergy identify and support rural veterans with mental health issues. It's based on the premise that in rural communities, remember we talked about mental health provider shortages in rural America, the fact that 93% of all entirely rural counties don't have a mental health provider. But the idea is that frequently faith is the center of the community in rural America, and we know that about a quarter of the individuals who seek help for mental health issues will turn to clergy. What we strive to do with this program, and we and our partners in the clergy office, is establish one-day workshops so that we can help them identify and refer these veterans that are facing significant challenges. So they're one-day workshops. In some cases, I think they bleed into a couple days. They're very popular with rural clergy, and they educate rural clergy on various mental health topics. We are now working, in fact, in conjunction with the Mental Health Office, Suicide Prevention Office in VA, and I know Dr. Lesher and her team in VHA are working hard to update the program to ensure that it stays relevant and useful for these veterans. But they've done, I dare say, dozens, if not 100 or more of these seminars over the years for rural clergy. Just in 2020 alone, we're going to see participating sites in 14 states across the board. This program is run out of our Salt Lake City Resource Center. They actually partner with VHA Chaplain's office to get this done. Again, remarkably popular program, and we think it has a real significant impact on increasing access for our rural veterans. So more than 7,000 clergy, chaplains, and behavioral health professionals have actually been there and who support those rural veterans. They've been trained, more than 7,000 of them. And the great thing is we've gotten increased interactions with and referrals to VA mental health providers. And more than 98% of our past clients in this program have said they would recommend that training to other clergy. It's a truly remarkable program. we're very proud and very we feel humbled that the chaplain's office would partner with us on this program to get this out to rural. They do a terrific job. So if you want more information about that program in particular, you can contact Kristen Petty. She's our program manager for the program, or the lead, Dr. Juliana Lesher with the National Chaplain Service. Write them they're all very nice people. Write them at those email addresses. More than happy to supply you with information about these programs. So that was kind of a pretty quick run through of the Office of Rural Health, and I see I've managed to yammer on for 47 minutes. So I'm going to stop here and, you know, ask my colleagues if we've gotten any questions that we would like to have answered.
Yes. Can everyone hear me? This is True Pauling.
I can hear you. This is Tom.
Right. Thank you so much for Dr. Klobucar for your wonderful presentation. I mean, it was so informative, and I know I gathered a lot of information. I did gather about 5 questions here on the side, and we'll start with a question from Yokusta Reynosa, and she says, is the Mission Act part of this mandate?
The Mission Act is a mandate that stands on its own. The Office of Rural Health is working under the direction of the Undersecretary for Health to ensure that, you know, we play our part in fulfilling the Mission Act mandates, in particular for underserved facilities and so on and so forth. So yes and no. I mean, the Mission Act does stand by itself. Our mandate was passed back in 2006 and then for the resource centers in 2012. But the Office of Rural Health is active in helping VHA fulfill Congress's mandate under the Mission Act.
Okay. And question 2 from Mr. Bill Ashton. He says, I would be interested in knowing how many veterans in rural America are not registered in VHA.
How many aren't registered? So how many are not enrolled in VHA?
Right.
There's about 2 million, right? So there's, you know, if we go back to that initial slide I had that shows how many veterans are enrolled and so on. So there's 5 million, about 5 million total veterans who choose to live in rural. Of those 5 million, we serve about 3 million in VA. So we're talking about 2 million veterans that live in rural that are not enrolled in VHA for health care. Now, this doesn't speak to, excuse me, Veterans Benefits Administration, things like education benefits, home loans and stuff like that. I don't have those data, but when it comes to health care, there's about 2 million rural veterans that aren't enrolled in VA for health care.
Okay. Question 3 from Mr. William Brown. Can partnerships between urban and rural veterans service providers be established, and is such a model existent today?
Yeah, that's a great question. You know, one of the challenges we face in rural recruiting for providers is, we don't want to be in a position where we're cannibalizing each other, right? So, if I make an offer to a doc and I'm in the VA and I pull them away from the community, that has impact on the community and vice versa, right? It will have impact on our veterans. So I think the establishment under the Mission Act of the Community Care Network, which basically brings a lot of community providers into the VHA service continuum for referral from VA medical centers to the community, I think that's a major step forward. We've always had community care, don't get me wrong, but it's a much larger program now so that we can actually partner with providers in the community to provide care to veterans through our community care network. That way the providers stay in the community, but they still are providing care for veterans who are enrolled in VHA for care. We also just recently in VA started bringing in public health officers. And so they are, this is the first time that we've ever had public health officers in VA providing care. That provides That's a new partnership for VHA. It's not very big right now, but we hope that expands beyond the current deployments, because public health officers, they can go virtually anywhere and serve in highly rural communities. So I guess, there's a lot of answers to this question around partnering with providers in the community. Exploring things like provider sharing agreements and so on and so forth. Those are questions that are beyond my ken. But I think the Community Care Network and our partnerships with Indian Health Service and so on and so forth are addressing some of the issues you might be concerned about.
Okay. And then we have another question from Brenda Carrington, and she wants to know, how are you caring for rural veterans that are on in-center or home dialysis, and if so, how are they coping with this pandemic?
Yeah, golly, that's such an important question. Dialysis in rural America is that's a tough row to hoe, as we say in rural. I don't have specific information on COVID-19's impact on that access. My office doesn't have any partnership programs that address even home dialysis, but dialysis in rural. But, I'm making a note right now, because that's something that we should really be thinking about, especially during this COVID pandemic. Let me assure you, I'm certain those veterans are getting care, but I cannot speak to the mechanics of that. But Celeste, if you send me an email with the email address of the person who just asked that question, I will find out.
I will. I certainly will do that. And I have question 5 from Mr. Robert Horton, and he says, regarding suicide prevention, how can rural communities access community training, crisis support, and firearm safety? There are programs through our local VA, the servicing VA medical centers. Rural communities is such a diverse term, because there's so many different rural communities across the country. And similarly, there are so many different VA medical centers across the country. But a lot of that kind of training and that kind of partnership those things are done at the local VA medical center level. So I would encourage you to contact your local VA medical center. Now, if you need information on that, you can find it on our website about how to do that. But if you can't find that, send me an email. Just use that ruralhealthinquiry.va.gov email address. Send us an inquiry there. I will ensure that you get hooked up with that. Okay, and we have another question here. We have some comments, and I'm going to say question 6 from Marvin Tanny. As a VSO, who do we put our veterans, our resources of the immediate? Okay, I can't really read this. Let me see if I can read this a little bit better than that. Let me go to the next question from Brenda Carrington. Well, how are you working, or do you have programs for rural surviving spouses that may be left alone?
I know our caregivers office has programs like that. And if you go to our website, we link to the caregivers office there. And so we have some programs that are focused on that. Again, True Lesta, if you'd write me, I don't want to give ambiguous answers like go to the website. But you can try it through our website, but I will be happy to pass that question right along to that office to make sure that you get all the information you need about that.
Okay. And there's a couple other questions here, and I'm going to go down a little bit further. There were a lot of comments. And it's one of the comments from Bill Ashton. Thank you, Tom, for the brief and the grant program your team put together for agriculture at VA clinics and hospitals. And another question from Paulette Richter. Are the rural veterans and HRSA. Okay, my question just popped up. It just moved. See if I can get it again. What about this one? Can you provide more information on community clergy training to support veterans' mental health? And another question.
Yeah, I'd be happy to provide more information on that. And again, write to me, and I'll actually put you in touch with Dr. Lesher, and she can talk. It's her program. She's our partner and the program lead. She'd be the one to ask that question of. If you want to write to me, I'll make sure you get linked up with her. If not, you can write directly to her and tell her Tom sent you.
Okay, and we'll get these questions to you, Dr. Klobucar. Question from John Blackard. I noticed here that on this website, https www.va.gov/health-benefits, there is not an option to select Texas, and that is from one of the maps that you showed. It's going to be kind of, you had several maps, so it's going to be kind of hard to find it. And there was a BTP map.
The Veterans Transportation Program?
Health benefits, yes. He said that he noticed there was an option. There is not an option to select Texas.
I'll have to understand that better because I can't speak to the benefits packages, but that's a website fail if that's the case. Could you send some more details, just that web address, and to me, and we'll get that run down because they need to get that fixed. If you can't select Texas, that's a problem, right?
Yeah, there are quite a couple questions about the maps here. The HRSA maps available by state and county. They have websites that they're referencing for information regarding the programs available in that area, and we'll get these questions to you.
So just briefly on the HRSA, the HRSA maps, HRSA, their maps, they can give you, they should be able to give you data down to the county level. And if they can't, write me and I will get you hooked up with their analysts over there. They're a really good partner. The Federal Office of Rural Health the Federal Office of Rural Health Policy is part of HRSA, and they're kind of our opposite number over there at the Department of Health and Human Services.
Okay, and I'll get one more question to you, Dr. Klobuchar, and then we'll get all the other questions to you, and we'll get answers for our audience. Any good tips on breaking the stigma barrier between rural veterans and help seeking? From Ms. Cynthia Ramirez.
Yeah, that's a tough one, isn't it? Because there's and I talked to our friends in the Office of Mental Health Services about this, and in rural in particular, just the identification of going to see a mental health provider sometimes can have can give people pause. They don't want folks to know that they're seeing a provider. There are some, our Office of Mental Health Services has tips about that on their website. I'm not a mental health professional, but I think if you we can, and again, I can find this information out for you, but I would explore. We've got some pretty good websites in VA. I'm not bragging. I think we got one of the better ones, but there's certainly that stigma with help seeking is a real issue in rural. And it's so much easier to identify in rural, because rural communities are small and everybody else knows everybody's business. And I've lived in rural, so I know what that means. So yeah, if you look at the mental health website, Office of Mental Health Services, and you can just Google that, and it'll show you their website. And if you're not satisfied, write to me, and we'll find out some more, because I know there are tips and stuff out there. I just can't put my finger on where they are.
Okay, great. Thank you so much, Dr. Klobuchar. If we did not get around to your question today, please provide, we have your email, and we'll provide answers to your questions as soon as we can. If you need to reach Dr. Klobucar or anyone on our team, here's a point of contact listing here on the screen where you can reach us. At this time, Mr. Washington would like to say a few words at this time.
Okay, thanks, Drew. I just want to thank you, Dr. Klobucar, for taking time. You have a very big audience out there, as you can tell. A lot of questions, a lot of inquiries. We're going to make sure to all the listeners that they get those questions answered. We'll get those to you, and we'll take care of those. But again, thank you for taking your time today. And all of you all, I hope you all found this very beneficial. And I can tell you by the questions, I think it was. But again, on behalf of the Center for Faith, I will pass it back to True. But on behalf of myself and the Center for Faith, we thank you all for joining us today. And please tune in to our next webinar next month. And you all stay blessed.
If you register for this event, we will send a handout to you after this webinar. This adjourns today's meeting. Thank you all for joining us today. Stay safe. Thank you.
Ladies and gentlemen, it's just the CFY team with Dr. Klobucar on the line.
Okay. Hey,
Dr. Klobucar, are you still there?
He's still connected via computer. So do you want me to expel him?
I just wanted to thank him. But I think he's already logged off.
yeah, we can take them out. Yeah, you can remove them, Will.
It's not letting me.
Oh, okay. Well, I think he just fell off.
Yeah.
Okay. Well, that was a full hour. So that was good. Okay, how's everybody doing?